family and population.
10 years ago today, representatives from 179 countries met in Cairo to address the complex and interconnected needs of population and development. The International Conference on Population and Development was a landmark effort aimed at balancing the world's people with its resources, as well as improving the status of women and ensuring universal access to reproductive health care and family planning. The program of action that emerged from the conference recognized that population size, growth, and distribution are closely linked to prospects of economic and social development, and that action in one area reinforces actions in the other.
Population has an impact on development, and one will notice that when people have other means of fulfilling themselves and achieving their goals, their families tend to be smaller too. We share this planet. It's a global village. We will be adding about 2 billion people more in the next 25 years or so. Most of them will come from the developing world with needs and concerns which we all need to be concerned about.
The United Nations Population Fund is the lead agency in implementing the program of action throughout the world. UNFPA, in partnership with governments, non-governmental organizations, and civil society associations, has helped establish, expand, or sustain population programs in 149 countries. As a consequence of UNFPA's advocacy work, most governments have successfully integrated population concerns into their development strategies.
We have sent a survey to about 169 countries in all the regions. And one important indication of the change that has taken place is that in some regions, Africa, Latin America, and the Caribbean, Asia, the response of countries was 100%. That shows the political commitment, that shows they are serious to present what they have done in 10 years. So that's the first indication of change and achievement.
The Republic of Ghana in West Africa has made population an integral part of its national development strategy. With the assistance of UNFPA and its international partners, the government of Ghana has established institutions and enacted laws promoting access to reproductive health and family planning services. Nowhere are these services more urgently needed than in the Ga-Mashi district of the capital, Accra.
Because houses have been built within the houses, there are no more space, open spaces for people to do things. And so what you get is a large population living in an area of about 2 square miles. And we're talking about a population of about 300,000.
Since 2001, new community-based health facilities like the Well Baby Clinic have been improving conditions for thousands of families in Ga-Mashi. Staff members attend to their small patients' health needs and instruct parents in the benefits of planning their families and having healthier children. The young women of Old Accra are grateful for the lessons.
There are a number of issues that they discuss about being a good mother. If you have large families, you can't be a good mother because you can't support a large family. So they offer advice on family planning.
Foremost among the Cairo goals is universal access to quality reproductive health services by 2015. According to a 2003 UNFPA survey, most governments are aware that reproductive health service is essential to achieving the Millennium Development Goals of reducing poverty, child and maternal deaths, and the spread of HIV/AIDS.
Maternal mortality reduction, infant and child mortality reduction, educational increases, particularly for girls. These are part and parcel of the Millennium Development Goals, and they're directly found in the program of action. But it's also the case that meeting the goals of the Cairo program of action will facilitate the attainment of the Millennium Development Goals.
The Millennium Development Goals is a very, very concrete objectives with roadmap for all the countries to reach. It's an agenda that is declared by the presidents of the countries for them to be accountable toward themselves and their people. And in the 8 goals, we say at least 4 of the goals are directly linked to the Cairo Agreement, the international agreement. Basically, maternal health, that's where we, is there related to maternal mortality, infant, HIV/AIDS, and empowerment of women.
But increasingly desperate conditions in the poorest countries and reductions in funding for population programs, notably for women's health and education programs, threaten to reverse much of the progress made since the Cairo conference. More than 350 million couples still lack access to a full range of family planning services. Complications of pregnancy and childbirth remain among the leading causes of death and illness among women of reproductive age in many parts of the developing world. An estimated 5 million new HIV infections occurred in 2003. 40% were in women and nearly 20% in children.
There's a funding challenge that is absolutely critical. The international community pledged itself, the donor community, to pay up to 2/3 of the costs of a comprehensive package of population and reproductive health. At this point, they have only met half of the level of their pledge. They are $3 billion short of what they pledged to make available at this time. Money isn't the solution to everything, and a lot more can be done with the money that's available, but you can't get something for nothing.
The United Nations General Assembly asserts that the International Conference on Population and Development Vision will save millions of women's lives and empower societies around the world in the next 10 years. According to UNFPA, today's challenges make it all the more imperative to carry out the Cairo Agenda so that its dream of a better future for all is realized.